Hi, I'm Dr. Jonathan Shaw with 6 ways to treat fecal incontinence. Eating foods high in fiber, such as fruits, vegetables, and whole grains, can help regulate bowel movements and prevent diarrhea or constipation. If that's not enough, taking fiber supplements is a great idea. Look out for and avoid certain foods or drinks that can worsen symptoms, such as caffeine, spicy foods, or fatty dinners. Pelvic floor exercises can help strengthen those muscles that control your bowel movements. Seeing a specially trained physical therapist and practicing those exercises can really greatly improve your bowel control. Biofeedback is sometimes used in physical therapy and involves sensors to monitor and provide live feedback so that you know what you're doing to strengthen those pelvic floor muscles. Loperamide, or Imodium, is commonly used to treat diarrhea, but if you take a daily low dose, that can help a lot to treat your fecal incontinence and to reduce your stool frequency. Sacral neuromodulation is a minor surgical procedure which involves implanting a small neurostimulating wire that helps control those overactive sacral nerves and gives you better control over your bladder and your bowel. If you struggle with fecal incontinence, you're not alone. We're here to help. Learn more at trinityhealthmichigan.org/Eurogyne.